Hello, everyone. Welcome to the Medicare Space Live Show. My name is Victoria Cabrera, and we are here this very Friday morning at 10 a.m. Central Standard Time. How are you guys doing this morning? I love to see you guys coming in, participating, asking your questions. As always, we talk a little bit of insurance and a lot of everything else, right? Mm-hmm. And who do we have? Who do we have to the right of? Good morning, Mom. Josie.
Josie. Good morning, San Antonio. Sylvia Toscano here. Hope y'all having a great week. Stay out of the heat.
Stay out of the heat. Is that the best you got?
It's the best I got. That's all. It's so hot outside. It's insane.
Yeah.
But thank God we got some rain.
Yes.
My flowers were like blooming this morning. They were so happy. I watered them. My bill was $168.
Ooh,
yes.
And the water bill?
My water bill.
Oh my
this
God.
month. So thank God
I got
they got water today. So I'm not gonna water them today. One day of relief.
Do you sing to your plants?
I talk to them, and,
Yeah, you're supposed to talk to them.
I talk to them, and it's like, look at you, you're not growing. What's wrong with you? Let's do exercise. Just like Will and Lulu, I talk to them all the time.
So you talk to your pets. You talk to your pet. It's kind of good sometimes when people don't talk back to you, right?
Yes,
it's
that's
like,
right.
You just do all the talking, and you're like, eh.
But what is it if you answer yourself back? That's how you know you're.
Yes.
Yeah.
Because my kids, I would talk to them, and they talk back, and the plants don't, or the dog. So yeah, that's a good thing.
Don't say that because I've talked to myself a lot, and I answer myself back a lot.
I do
God,
too.
great.
Well, I ask the dogs advice, like, should I do this? And I'm like, yeah, you're right. I should do that. So I'm kind of answering myself through my dogs.
I don't think I ever talk to myself out loud. I'll talk to myself like I'll racing thoughts, like of things I have to do or things, but answer like talk out loud to myself. I don't think I do that.
I do that.
I'm like, what did I?
Unless I do, I don't know. I don't think I do that.
I didn't realize that I do that more often than I thought. But my daughter always tells me, "What are you saying?" Because I'm like mumbling or
jumble.
Yeah, she's like, "What are you saying?" I'm like, "How do you know?" She's like, "Your mouth is moving, Mom. I can tell." All right,
Mumble jumble.
That's
yeah.
funny.
Well, I always said that I'm gonna do the hashtag I speak Sylvia. So I think there'll be a lot of people that would wear that shirt. I'll have to get with like Valerie and everybody to say, hey, y'all want to sport this hashtag I speak Sylvia?
Yeah.
Do you know what we're talking about?
Of course. But that's like all my family. So to me, it's like we're all the same. Our families, like we all speak like that. So to us, it's like normal. Y'all are the ones that are not normal.
I understand you now.
What's up? Hashtag salty, Mr. Joe Camper. Hey, I just saw how did I miss it that you were in San Antonio? I guess I saw that late. Next time, Joe, when you're in San Antonio, just direct message me or get my cell phone number so that way you can text me. You can just come by the office and rate the live show. We'll get on.
Not the liquor.
Not the liquor, just the or both. Maybe the live show and liquor and live. Oh,
liquor live.
We should do that. We should
change our show to
we
that.
should do that.
I'm just kidding.
Yeah, 100%. So we were talking about Sylvia, but who do we have next to Sylvia?
A-Rod.
A-Rod. You need
sassy,
back to A-Rod.
sassy, classy, and the little badassy.
Oh, I love it.
You've been practicing that.
Sassy,
You missed it. That was I did it for the first time last week. So
Oh yeah, you
that's
missed
right.
it.
I was in here last week.
She was
Sassy. Say it again.
sassy, classy, and a little badassy.
I like that.
Yeah. When you make it one word, it's not really a bad word, right?
No,
Badassy?
Yeah.
no. I just
It's like-
jumbled it together.
And I always want to say like the soccer players, like go, like A-Rod. Wait, no, that's like ready to rumble, right? Aren't
Well, I mean, if you really think about the word ASS, but it's honestly like I think in the world we live in now, I think that's not rated R anymore or like MA.
No.
It's like PG-13.
well, you know that you can say BITCH because
they say it
technically
all the
that is
time.
related to the dog thing, and then
Yeah.
ass is a donkey, right?
Yeah.
Yeah.
So
I guess
it's not
I'm a
really bad.
donkey ass.
Yes. Donkey ass.
A little bad donkey, a little bad donkey.
Like I posted a picture the other day, yesterday. I have a fanny pack in when I was telling Victoria that I went out and the sun wasn't out. It was kind of weird. Usually like the sun is rising by the time I go out running, and I go at the same time. I have like a little fanny pack and it lights up. So I posted a picture of it, and I said, my fanny lights up.
Oh.
And then I was like, for those people who get it, it's a double entendre, like my fanny and then my fanny.
Where does it light up?
It has like a little bar, and it has a little button that it just lights up.
Cute.
Yeah.
Little Aunt Fanny.
Aunt Fanny coming through.
I like that.
That is
Aunt Fanny.
My fanny lights up.
Oh my goodness. Well, how are you guys doing this morning? The individuals that are on the show, thank you so much for always joining in at 10 o'clock. I know every time, I think sometimes 10 o'clock is too early, and Adriana keeps saying move it to 10:30. But I like 10. I like 10 o'clock.
like 10.
Let's hope our battery doesn't die again. I don't know what's going on with my camera. So you guys might get at the 40-minute marker, a black screen. So I think that's going to be our new thing, is we do half in video, half in black screen.
Yeah. And then we just keep talking.
I know.
But as always, let us know what you guys are doing this weekend. Let us know how you're doing. Let us know if you have questions, comments, concerns. What are you guys up to? What's bothering you? Let's spill the tea, right?
Yeah.
But guys, what have you guys been seeing here in the community? I know that, or what have you guys been running into with your clients lately on Medicare?
Well, I do. Before I get to the Medicare, I've helped two of my clients. They have family members who passed away during COVID. So I helped them fill out the paperwork. There's this organization that refunds them. And so both of them, one of them got about $3,500 and the other one got about $4,900 refund. So they send them the receipt from the funeral home. And everything from the funeral home,
like funeral expenses,
everything, where it was done, and the death certificate saying that they did pass away from COVID.
Do you have a resource to that? Or
yes, I have a resource.
Okay.
And so I always tell my seniors, and I've posted it on my Facebook Live before. So I posted it and somebody else called me. And so I helped them. And one of them called me this week. And then I called the other one. It did take about 2 months. And they called them back and they asked them some more information. But they gave them, they paid more for it, but they did give them, 40, I think it was 48 or 49, and the other one was 35. But I mean, still, that's something, when you're struggling, and they had their family, they said everybody chipped in their family. One of them, they had to get them cremated. So, I mean, it really helped them. So it did work, because I was a little leery when I sent it. I'm like, well, I wonder if they really do it, or it's just something that you see on television. She said she got the number from television. So I wasn't sure if it was really legit and stuff. So now we know, it's like, if anybody knows anybody that I can help with that. And
so
why we need a fax.
Yes. Oh, so do you have to
fax them? Yeah.
So how did you hear about that program?
She told me. I was at HEB, and she's one of my clients.
Okay.
And her son was real sick a while back. This was like about a year ago. And then we sent it in March. So in March, she went to HEB. She goes there often. I've helped her with the Medicaid. And she said that she heard she had this number and that they would help them for the funeral expenses. So I called them and they said yes. So they gave me all the information. They sent me, they told me what to write. So I had to send them the death certificate and the information from the funeral home. And then the back, I had to give them all this information about the person that passed away.
Yeah.
And how he died, his date of birth. And then we just faxed it. And so.
And was there certain
that's pretty good.
Was there certain criteria other than them passing from COVID that was the only requirement?
That was it. It had to be from COVID.
Good morning, Miss Rebecca Davis. I wonder if you can come on. If I send you a link, I wonder if you can come on, Rebecca. I don't know if she's available, but maybe we'll get you on the next show. How about that? We'll get Rebecca on the next show. And Joe, we'll get Joe on the show too. Because those guys and gals have a lot of value to bring across the board too. I know Joe does a lot of PNC stuff, so I'm sure he has little tips and tricks. And Rebecca, just in general, has knowledge about a lot of stuff, like a lot. But yeah, that's a great service. That's an awesome service. And sometimes what we learned is our clients educate us a lot too about programs that sometimes we don't even know about. And then that allows us to pass on that information too.
Another one that I've been doing in the last 3 weeks is there's a program that pays them $30 a month for their cable.
Oh, okay.
For seniors.
So we need to, you know what we need to do is put a list together and possibly, or even create a little website or a forum for clients where they can go and post their stuff that they use for like that kind of stuff, like that's not necessarily related to insurance. It's just related to saving money.
Them. Yes. And so he went up to me because he found out about this organization that helps him with the cable. And so he's like, can you help me? So I went online and I did the application online for him and helped him get an email. And so then like literally a week later, he said, yeah, they called him and they're going to pay his Spectrum $30 a month.
That's awesome.
I'm like, wow, that's cool. So now I'm giving it to everybody.
Since we're on saving money, because we didn't get to do it last week, but so I have my phone bill or my phone company's T-Mobile. And they have this thing, it's like Tuesdays or something where they post a bunch of things. It's an app through the phone. And so for gas. So I pumped gas and I got it for $3.80 a gallon because I was able to go on there on Tuesday and like set up. It's kind of a process, but it's totally worth it. It's different apps you have to download. The T-Mobile app. The other one is a Shell app and for gas. So I almost filled up my whole tank for like under $40. So it's actually pretty good.
That is pretty sweet.
Yeah, that is.
So it's like 25 cents that I ended up getting off of my gas
and
per gallon.
It's only 20 cents, but
it adds up.
Pump it and you see the end amount. It's like, yeah, that's a big save.
I was just telling Emily and Rebecca, there are some friends of mine. I was like, guys, and I think I told some of you guys, I'm like, man, I was taking care of my niece and nephew. Not taking care of them, but they were visiting and we did some stuff those last couple of days. And the first day we went to the movies. And I'm like, okay, I was like, let's have popcorn, let's have pickle, let's have hot dogs. And my of course, my nephew's taking advantage because he's probably like, my mom doesn't let me eat all this. He's like, can I have a pretzel too? I was like, yeah, give him a pretzel. And then after that, they were picking up Twizzlers. And I said, no. You pick pick one thing. And then they got a slushie, like $100 later on just snacks at the movies. I'm like, oh my God, I don't remember it being like this. Took them to a taqueria. Okay. For those of you that know Mexican taquerias, they're pretty inexpensive, right? Yeah. But they wanted pancakes and eggs. And I couldn't seem to find a place that was like just right now because we were going to go to the zoo and stuff. Well, pancakes and eggs, guess how much? Child's plate. Just guess.
15?
No, not that much.
5?
Just for one pancake, one bacon, and an egg.
$6.
$8.99. Normally I get huevos rancheros for like $5.
Yeah.
But I was like, oh my God, which is good. And so I was taking them to the zoo and not a lot of people were there because it's super hot, but it was actually not that bad because it was like overcast. But either way, I brought them hats. So I was like, okay, guys, we were not prepared to come to the zoo because we were going to go to the dooseum, but they're requiring masks now and we didn't have any. So I was like, okay, pivot, let's go to the zoo. Well, it was too hot. So I was like, okay, your mom's going to get mad. So we got to go into the safari thing that they have and we're going to buy y'all hats. We're going to buy y'all. So they had hats. They had the spray bottles. So the whole time they're like just spraying themselves with the spray bottles and the fans. And I'm like, okay, that'll be $100. I'm like, oh my God. And even my niece was like, $100?
That's funny.
And then we were going, they wanted, halfway through, they're like, hey, Victoria, can we get some dips or what are those?
Dippin' Dots.
Dippin' Dots.
What are those?
They're those little ice creams that are like dipping dots.
They're like in the form of like little balls.
Okay.
And they're like, hey, Victoria, do you still got money? I was like, yeah. I was like,
use all your money?
Because they're like everywhere.
You're actually, no, these last 3 days, y'all have made me go broke.
Because the funny thing is that everywhere we would go, it was like $100 was the magic number, right? So it's like $100, $100, $100, $120. This is like, so I was like, dang, like I've only had you guys for 2 days. I can't imagine having kids my whole life.
Oh, God, they're expensive.
I'm glad you say that in front of certain people here present today. Because like, Well, I think she's starting to see it too, because she'll go to the store with me and she'll see how much I pay. And she's like, you pay that much? I'm like, yeah, I do. It's not cheap. It's expensive. Like everything is so expensive. So, but I've always been a saver. I think always been a saver. Because when we first moved out, we didn't have very much money. So I had to learn to save.
Yeah.
And that's just my personality. I like to save.
Yeah.
And I like to use my coupons. Like yesterday I went to CVS and I wanted a snack and I was like, ooh, CVS, I have a coupon.
Oh my God.
If I go to,
and my husband's like, oh my God, he gets so annoyed because he's not like me. He's like you. I'm a Carmenza and you're a Lorenzo. Like he doesn't care for coupons. If I give it to him, he'll forget to use it. I'm like, did you use the coupon? He's like, oh, I forgot to, babe. I'm sorry. I'm like, damn it, you could have saved $5. Like, what the heck?
I'm one of those people, like when you go to events and they give you like the ticket to get either a beer or wine, I'm like, I want my liquor. I'll just pay it.
Yes,
like
I give it to somebody else. I'm like, here, I don't want that. And I don't drink that beer either.
Some people are like, just give me your tickets. And I'm like, I'm all bougie when it comes to the drinks I drink. I'm like, I don't want that. But yeah, so I'm exactly like Lorenzo. I'm sure I'm not a saver as well. But you know what? I'm starting to get on this saving train because this inflation.
Take me up in about 3 weeks.
Yeah,
because I'm still not there.
This inflation is not a joke. So we are going out of the country here in the next few days, and of course, it requires a COVID test to travel. And Carmenza this morning is like, babe, it's $215 for a rapid COVID test. I'm like, what? And she's like, yeah. I was like, no, we could probably find one cheaper. But she's like, no. So I'm like, okay, 200 times 2, that's $400. That's typically like a good 2 days of, just spending money here in the States or more.
But where are you getting it?
I don't know. So I was going to ask you guys, like, where y'all,
Could you just get one at your doctor's office?
It would have to be like the rapid, like the one that's 48 hours or 72 hours. So
you can't get it anymore, like at Walgreens or CVS?
I don't know. I'm sure you can. She was just looking online this morning, but I'm like, no, we can call around,
Or you can probably go through your doctor's office. Go through your doctor's office, or maybe even urgent care clinic.
Yeah.
They're not doing it.
Suckers.
Or at least when I called them, they said no, that they weren't doing the
rapid
COVID.
ones.
Yeah.
So yeah, I mean, and that's crazy because a lot of people are traveling right now. So it's harder to get those tests done. It's and we have to. We don't really have a choice, or we can't go. But
and then we'll have to do another one when we go to Cancun.
And then we have to do another one when we go to Cancun. Yeah. So, and I gotta be sure, like, because of course we're gonna be on 5 different planes. So I gotta it's gonna be hard for us
to go in a bodysuit.
I'm gonna have to go in a bodysuit because I ain't missing our Cancun trip, man. I'm but I'm looking forward to Belize too. Anyway. Where are you guys going this July? Thank you so much for joining in, guys. You guys are so awesome for always participating, for always joining in. Ask questions. We want to answer your questions. We want to know what you're doing. We love engaging with the audience. We love chit-chatting you guys up. I'm sure you guys don't want to just hear all about us all the time. But we are going to talk a little bit of insurance right now. What are we going to talk about?
So I ran into quite a bit of people this last week where they were, and I think it's just by the grace of God, I think that this was happening. So they were getting enrolled into plans, but the plans were getting declined probably because of the enrollment period that they were using. But these people, their very unique situation was that they had received their Part B, their Part A and their Part B, but had never enrolled into a plan, and they had never picked up Part D coverage. So here we are 10, 20, even 30 years later, and nobody was, and they weren't even told, like, hey, you're going to have a penalty when you enroll into this MAPD plan. And so for me, I was like, oh my gosh, they didn't tell you this? And they're like, no, they didn't tell me that. I'm like, I'm so sorry. Like, that's their job, to make you aware that you're going to get a penalty once you get enrolled into this plan. Now, I unfortunately can't tell you what that penalty is, because that's something that's calculated through CMS, and they let the carrier know. The carrier sends you that bill, and they'll tell you how much you have to pay on a monthly basis.
They can call Social Security too. They can call Social Security and
they'll add it up for them.
Usually we don't try, but we'll tell them it's 1% for every month you go without it.
Yeah.
But it's hard because we're kind of playing investigator, right? We're like, okay, did you ever have group insurance? Do you have VA? Do you have that? Well, VA is not credible coverage. Oh no, it is credible coverage.
It is.
Did you have VA? Did you have this? Did you have that? And we try to find if there was any breaks. At any point, did you have a prescription drug plan? So yeah,
then every year it's different. So one year their penalty might be $20, and then the following year it might go down. So because they do an average.
Yeah, they base it on the national average premium of the drug plan or the drug premium.
So I was really taken back and like, I'm not gonna lie to you, so disturbed by the lack of knowledge. And then like, also I think compassion for these people, because it's like, you're so quick to make a sale and you're not making them aware of that. So for me, it was like, oh, and then I also have to give props because this is the kind of environment that Victoria has created, right? So like, she didn't have to help me, but she helped me with this client who's applying for like LIS, extra help, and Medicaid. So Sylvia actually reached out to her for me, and she's my client to help her apply for these programs. Because if you do qualify, they also help pay for some of these penalties that you do get. And so for me, I was just like, oh my gosh, I can't believe nobody had ever told them. And both of them that I spoke to, they were like, thank you so much. Nobody ever said anything to me. And I was like, yeah, because I would hate to enroll you into this plan. Then all of a sudden you get a bill and you're like, what is this bill? You didn't tell me anything about it. And you told me, because I told you about this. I was so disturbed. I went to Sylvia and I was like, Sylvia, what the heck? Like, she's like, it happens all the time, Adriana. She's like, people come up to me at the senior center and show me
the letter. They get a letter saying that they owe, and that they have to pay every month. Now, if they're in an insurance, and insurance will never drop them because they don't pay the penalty. But I've seen certain insurance where they'll give them 6 months after like 4 or 5 years of them not paying the penalty. They'll give them like 6 months. Okay, you have to pay the penalty or we are going to drop you. And that I've only seen it twice, but I know I've seen seniors that don't pay it and they keep getting letters and letters, and they just, they can't afford it, or, and they'll finally get a letter saying, if you don't pay us, we're going to just drop you from the insurance. So I guess that's just one of the things that the insurance can do. Another thing that happened to me this week, I met with a client, on Thursday, and she's coming off group insurance. And so she already picked up a plan. And so effective this month, and she was just asking me about it because somebody sent her to me. So she has a lot of prescriptions. And so when I go, let's go over your prescriptions. Well, on the 3rd month, she's going to fall in the donut hole right away. And I asked her, when you spoke to this person, did she tell you about it? She's like, what is that? She's like, no, she told me what I was going to pay all year for my prescriptions, which is for the first 3 months. But she didn't tell her that on the 4th, that was it. It's going to be over. If she stays with her group insurance, it's not going to happen. So it's like, you have to make a choice, and they're letting her have, she has to let the insurance know by the 22nd of this month if she was to stay with her group insurance. And then they're going to give her one more chance. But it's like, you really have to think about it, because you're going to be paying a lot of money. Her prescriptions, and they're not generic. They don't come in generic. There's no way she's going to change. So, and it's just sad that these agents aren't communicating and helping them.
They're not. Yeah.
And it's fear on them, because they're thinking, if I tell them, they're not going to
enroll.
And the bad thing is that she spoke to this agent who only sells this particular insurance. And that's one good thing about us, is because we sell all of them, we can, plug it into the system and say, okay, with this insurance, you're going to fall in the donut hole in March. And on this one, it won't be till October. So once I showed her the insurance, and so it's like with us, we give them that choice. We have so many insurers we work with, and we don't just, okay, you have to pick this and that's it.
Now, I want to go back. I know I want to go down the line, because I want to go back to your addressing the concern of the Part D. When people go, let's say 5, 10, 20 years without that Part D, they never had it. They never had creditable coverage since they've been on Medicare. What are some solutions that you give them? What are a couple of things that they can do?
So I tell them, I'm like, look, so there's programs, like I was saying, the LIS, and the Medicaid programs, helping for them to see. Now, if if they're like, they make too much money, this is a picture I paint them. Like I tell them, look, the reality of the thing is this: you've gone this far without drug coverage. You waiting another year for going without it will only make that penalty increase more. So at this point, it sucks. For lack of better words, you have to tell them, like, I'm sorry, but you're going to have to bite the bullet. I mean, think about it. So, and I give them all of the options, right? I tell them, like, okay, so you stay on original Medicare, you're exposed to the 20%, right? There's no maximum out of pocket. You have no drug coverage. Yes, you only take 1 or 2 drugs, but you don't know what's going to happen in 5 or 10 years, right? We're living till 90, 100 years old. So 70 years old is still young.
Yeah.
And I tell them, I'm like, okay, so you have this option, or you have the option of, if you make under a certain income, let's help you apply for these programs. So that way you're not having to bear the brunt of this penalty, right? And then the other option is take the plan on because you make too much money, and you're going to have to pay the penalty.
Yep.
Because it's going to outweigh think about it. Either way, you're going to pay. You're going to pay the 20% or you're going to have to pay your penalty.
Yeah. Now, there's one other thing, right? One, they can go onto a Medicare supplement without the drug coverage, but they're going to have to pay the premium for a supplement and be underwritten most likely, right? Because they're not new to Medicare. Or number 2, you can go with an MA only plan with no drug coverage. Obviously, it has to be within an election period that allows you to get into MA plan. But that still doesn't solve the drug plan, right? The drug plan, but there are resources. So let's say that person decided to enroll in an MA only plan. We typically will guide them into things that they can do to get those medications, whether it's via a Canadian pharmacy, going to the doctor to get samples until they could figure out a solution financially, or maybe they just got prescribed a medication and they're outside of that enrollment period where they can get a PDP or a plan that offers a prescription drug plan. Now they need to pay the penalty and they'll get coverage. So there's always a solution to the problem. It's just that,
not
like Adrian,
your most favorite or cheapest.
It's not going to be the most favorite or cheapest. And then going back to your thing was when somebody was on the group insurance and they go into a plan, even though it seems like they're saving money leaving that group plan, it's not always the right thing, because because at the end of the day, keep in mind, this is a medical and hospital plan. Yes, drugs come with it, but you got to weigh out the options, like what's more expensive. And I know if Galen was listening to us right now, she'd be like, you better be selling cancer. You bet. Cause that's where those costs are, right? Yeah. Those cancer drugs, those high cost medications. We have a question I want to answer. Hello, ladies, please. I would like to know the difference between HMO, PPO versus Medicare Select. I have it clear about the first 2, but I'm confused with Select. Okay. So really quickly, HMO, Health Maintenance Organization. An HMO is basically you have in-network benefits only. There's no out-of-networks. The only thing that is covered out-of-network is urgent care and emergency care. And you have to, in most HMO plans, as long as it's a true HMO, not HMO POS or HMO whatever, it's HMO. If it's a true HMO plan, you have to be assigned a primary care doctor, which we typically call the gatekeeper, and they have to refer you to a specialist, right? That's an HMO. A PPO is a preferred provider organization. Basically, that's what the acronym stands for, but a PPO is in and out of network benefits, meaning they have benefits in network and out of network. However, in most typical PPOs, the PPO out of network costs are much higher than they would be in network. So if you have a PPO, it makes more sense to stay within the network of providers, but you have that flexibility. PPOs are typically higher in cost. Their copays are a little bit higher, and you do not have to get a referral to see a specialist. You can go in and out, see doctors as you please, as long as they're in a network. But let me address the Medicare Select plan, okay? Medicare Select plans, which not a lot of people talk about, is basically like a standardized Medicare supplement. But so they cover the same as a standardized Medicare supplement, but with the Medicare Select, you are within a network, which is really weird. So even though it's like, because supplements, you typically say you can go anywhere you want. Yes. Well, with the Medicare Select plan, it's almost like a hybrid between a network of a PPO, but then you can have the benefits of things like the benefits actually being covered like a supplement. So just think of it's like a supplement had a baby with a network. I don't know how to explain it. Maybe somebody out there can explain it better. But that was my 1 minute overall.
Yeah, there's some carriers that I think we run into that right. That I had spoke to somebody on the phone and they were like, "Oh yeah, I'm on this plan, right?" And I was like, "Sylvia, what is this?" And she's like, "Oh yeah, it's almost acts like a supplement." They were pretty good benefits, and they're not available in every area,
right?
Yeah.
So another thing with as far as helping people that haven't picked up the drug coverage, we have the LIS, which is low income subsidy, which helps them. Now, there's a lot of medical groups that I work with that people that don't qualify for the LIS, they help them with the state program. And them themselves have certain prescriptions that they partner up with pharmaceutical companies. So for their clients, they'll get these prescriptions like insulin or whatever prescriptions are certain prescriptions for diabetes, for heart condition at $5 when they fall in the donut hole. And these are just specific medical groups. So when I come across people that don't qualify for LIS and they're going to be paying a big chunk of money and they don't have a provider, then, at that point, I'm like, look, why don't we partner up with this medical group? Because they will help you with your prescriptions. If they are not going to that provider, then they're going to have to speak to them and see what they provide. Nowadays, a lot of providers, I've got 2 now that are helping with that. They're applying
now when you say providers, because remember,
provider groups.
Okay, provider groups. Because people get mixed up, right?
Doctors. Yes, doctors. You're right.
we know in the medical field that providers are the doctors, but some people call their providers that actually take care of them providers, right? Those non-aiding medical attendants. Sorry, go back.
Yeah, no, you're right. The medical groups.
Okay.
And so there's several, I know 2 medical groups in San Antonio that do help them and do a lot. And so these are people that don't qualify, that their income is above the LIS level, but there's other programs specific for those people. So there is help out there. It's just a matter of talking to the right person, talking to the right going into the right medical group.
Yeah. And if you're an agent, because I know we have a large audience that it's grown into agents and other people like community partners out there that listen in. If you're an agent and you're listening, it's so important because when you're new, all you're worried about is making money, right? You got to get out there, make money, hustle. I get it. But if you're not taking advantage of training, of taking advantage of local provider groups that are offering services to seniors, even like the things that you're learning about, like the tips for the cable and stuff like this, like just resources for your client, you're really, 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 1, you're doing a disservice to your client potentially, and 2, you're not growing and getting better at your craft to be able to help your clients more, right? So it makes sense for you to dedicate 4 or 5 hours a week to specifically training, but not just book training. Get out there and meet people and learn, because I learn new stuff every day. I'm like, what the heck? Like I've been doing this for like
collaborate be collaborative with people. And obviously be careful who you collaborate, because you could be collaborating with somebody who gives you the wrong information.
That's true. That's true.
So make sure that the person that you're collaborating with, whether they be young or they be older, because there's some people who maybe are newer in the business and they're really well versed because they study, or there's people who have been in the business for a long time and don't know what the hell they're talking about.
They're just,
they haven't gone to trainings in the last 5 years.
Yes.
Just like anything else, guys. Okay, I know agents out there that have been doing this for 15 plus more years, and they still don't know what an electronic
signature
is, or and no
shade, but it's just a fact of life.
Yeah.
If you don't stay updated in your craft and really study it, it goes with any industry, then you're going to fall behind. You won't know. I can honestly tell you that I can always go to Sylvia when Victoria's out of the office or she's busy doing stuff. I can always trust that she's going to give me the correct information.
Yeah.
Like I don't.
And sometimes I'll be like, Sylvia, that's not right.
She's all. That's wrong. What are you telling her?
But we had these 2 great meetings this last week.
Oh yeah, tell us about those.
We had Medicare 101.
I was hoping you would bring those up. I was about to brag for you.
Only because of this particular client I met. So we did 2 great meetings, Medicare 101, Zach and I, and we had a great turnout. We had 36 at Tuesday night, and we had almost about the same amount. And it's unbelievable.
Yesterday night, right?
Mm-hmm. It's unbelievable the amount of people that had no idea about the Part B penalty or the Part D penalty. I spoke to one lady who got her Medicare in 2005. And she's never had a drug plan. She wasn't sick. She was disabled, but what the prescriptions she was getting, she was already getting them at HEB. And I know HEB, a lot of the prescriptions, if you don't have insurance, you get them for $3, $5. Target does that too. Well, in the last couple of months, she's a diabetic now. So now she's paying 100%. And so she's also turning 65, which is, when a person is disabled, a lot of times I've come across people that are disabled and they don't think the rules about Medicare apply to them. So she felt like, I don't need a drug plan. She knew about it. She knew about the penalty, but because she wasn't 65, she was under the impression that it doesn't apply to me. So when I was there telling them about the penalty, even if you're disabled, at the end, she's like, I had no idea. I did not know. Nobody ever told me. And everybody else was just getting ready to turn 65. But a lot of them had no idea that there's penalty for the drug part.
Yeah. Okay, hold on. Because if they're turning sick, did you just say that? Because I'm sorry. I was totally.
So she's disabled. She's had Medicare since 2005.
But she won't be her penalty will be waived now.
No, it won't.
Are you sure?
Yes, ma'am.
We'll have to verify that.
I just verified it.
She just checked it because I asked her the same thing the other day. I thought I was
no. You know what? I'm sorry. I totally sorry.
Brain fart.
I was thinking about when you're disabled and you've been on Medicare and you're going into a Medicare supplement. At that point, there's no medical underwriting. That's what I was thinking of.
Yeah. Because I thought the same thing too. I was like, I had run into somebody who this gentleman was told by a person. I'm
still gonna triple check that one.
By a person.
I'm kidding.
So he just turned 60. He's going to turn 61. So he's not 65 yet, but they had told him he couldn't get onto an MAPD, which is a Medicare Advantage plan, until he was 65.
Yeah.
So he'd been on Medicare since 2018. And I was like, oh my goodness. So that's another thing. Cause we were just doing AHIP. As long as you have Medicare Parts A and B, you qualify for a Medicare Advantage plan. Now, there is some, like Victoria was referring to, there are some states where you cannot get onto a supplement plan before you turn 65.
Or it's like
So
Plan A.
You can get on
certain ones, but they're not the best ones. They're not going to cover a lot.
Like 4 times the amount because I've quoted people
in Texas. I believe it's Plan A, and it's ridiculous.
It's like $600 when I quoted somebody.
Yeah. So for me, I was like, oh my goodness, and after I finished the process, I was able to explain everything to him, break everything down for him. I sound like a broken record because I really want them to get everything I'm telling them. Like, hey, you're going to have to pay a penalty. You still have to pay your Part B premiums. You're going to have to, and if your plan carries a premium, you'll have to also pay for that. So I broke everything down for him and let him know. And he's like, thank you so much. He's like, the last lady I talked to didn't go into detail about this. She just told me basically she couldn't help me because of my age. And that was the end of it.
Yeah. Yeah. And one thing for you guys that are going into Medicare Advantage plans that have 0 premiums, if you ever, like, let's say you enrolled with an agent and they signed you up with XYZ company and they told you it was going to be $0 in addition to your Medicare Part B premium, right? You still got to pay that. And then lo and behold, 10 days, 20 days later, whatever, whenever they send the bill, you get a bill that says $5, $6, $7. And you're like, what the heck? I thought it was going to be 0. Well, typically that's a good indicator that you may be experiencing a Part D penalty. Yeah. So it's not the insurance company that's charging you. So what happens is anytime you pick up a Part D plan, whether it's a standalone prescription drug plan or a drug plan that's embedded in a Medicare Advantage, whatever it is. So let's say you have a drug plan that's $10 a month and you have a drug penalty, you may see an increase because that company that administers your drug coverage is going to have to pass along that penalty billed through them. Mm-hmm. It's not going to be Medicare billing you directly. It's going to be them billing you directly because they speak to the insurance company and they say, hey, this person incurred a penalty based on not having drug coverage, and then they have to administer that payment, right? They have to process that payment. So it's not the insurance company. So some people will say, I want to change my plan because I don't want to pay that penalty. I don't know why I always talk like that voice. Like, no. That's my like upset that's your lady, old lady voice. Okay.
Yeah.
I don't want to pay that premium and I'm going to switch to another insurance company. No, it's going to follow you wherever you go. Same thing like what, Sylvia? Same thing. What else follows you wherever you go?
The penalty for the B.
No. What else? Related to Part D.
The penalty.
Oh, the donut hole.
The donut hole. Yeah.
Yeah. So you talked about this the other day. I think you were talking to a client and they were trying to change because they're like, man, I'm in the donut hole. I'm going to change from this company to that company. And she's like, no, you're not. It follows you wherever you go.
And that's one of the I always tell people when I sign them in and I explain to them about the donut hole. I always tell them that I get calls from other people calling me with other plans and they're telling me I'm in the donut hole. I want to change insurance. And I'll tell them, I'll change you. Oh, I don't have any problem, but you're still going to be in the donut hole with the new plan I'm going to put you.
Yeah.
I mean, there's no way of getting out.
Doesn't reset.
It doesn't reset till January the 1st. So,
yeah. So we're trying to, we're coming across a lot, man, it's funny with you, Adriana, and probably you too. And you go through these periods where you always come across that same identical client. Like you've already run into like 4 people that are experiencing these large drug penalties, which a lot of agents overlook, right? They get excited because they're like, yes, I finally have somebody that is interested in working with me and they have Medicare and I'm going to enroll them. I checked their doctors. I went over the plan. I checked their medications, but they didn't ask a question. They didn't ask, what did you have before? Mm-hmm. When's the last time you had drug coverage? When you meet somebody that has Medicare for 5, 10, 20, 10, let's just say 10 years, wouldn't it make
the first
sense
question
to ask? What do you have in place? What did you have in place? What's the reason why you want to change?
A good question to ask that Victoria taught me is like, how much do you pay when you go to the doctors?
Mm-hmm. Oh yeah.
That's like a huge indicator because depending on the plan, most MAPD plans, the co-pays for you to go see your primary care doctor are low. They're fairly low, right? So when somebody comes to you and tells you, oh yeah, I pay $100 when I go see my doctor, I pay $45. I'm like, oh yeah, you're on nothing.
Yeah, you're
just on original Medicare.
Another thing I run across is they'll tell me, I pay $0. I'm like, are you sure you pay $0? Yes, I do. Well, but then I get a bill for like $80, $90. I'm like, well, then you're not paying $0. No. So they're not billing them when they get there. They're billing them, but it's like, no, you don't have anything. You're just straight Medicare.
Yeah. If you guys have any questions, let us know. I know that was a really good question about the Medicare Select plan. That is confusing to a lot of agents because we honestly in Texas, we don't write a lot of those. Right. Like we don't, I don't know about other states. Our primary state that we sell in is Texas. But it's not real popular. The most popular plans are HMO, PPO, and just regular Medicare supplements, Plan G, Plan N, Plan F, those that still qualify for Plan F. But there are different plans that you can structure to make sense for that client, but we don't offer a lot of those. So, but that was a great question. Thank you for that question. Anything else that you guys are coming across? That's a good conversation because people just think about Part B penalty. They don't think a lot about the drug penalty and they think, oh, it's okay. It's not that expensive. I'll just wait to get it. Like I have a lot of clients that are like, I'm holistic and I don't take medications, which I can totally relate because I feel like I'm like that too. Right. Now, if the drug makes me feel good, I'm just like,
and I need to get it prescribed.
My drug is caffeine. That's my drug. And wine, right?
And wine.
And a little bit of wine.
And whiskey.
And okay.
Hey, then you just keep going on. It'll get longer and longer and longer.
I stopped there.
Yeah. So for those people that are all about not taking medications, we totally get it, right? We totally understand, but there's always a but. But when or if you can't decide, or you can't predict whether or not you're going to get cancer, whether you're going to get a heart attack, whether you're going to get diabetes. Some people get diabetes just because they were eating too much sugar and they didn't
or
realize.
Even that is just genetics.
So you just never know, right? Like some people get allergies out of nowhere. Like, man, I was never allergic to peanuts, and now all of a sudden I'm allergic.
All of a
to
sudden, I
peanuts.
can't have any nuts.
Man, all of a sudden
I love nuts.
Man, all of a sudden I gained 40 pounds. What the heck?
Oh my God, where did this come from?
Where did this Aunt Fanny come from?
Oh my God, was Fanny there the whole time?
Like, where did it?
Look, people, here's the thing. I say this all the time, but here's the deal. You all watch crap on TV that is not beneficial or educational, like a lot of crap, and watch a lot of dumb stuff. Listen to us, because let me tell you something. If those people that I had talked to had somebody that had some type of knowledge, they would not find themselves in these situations. And it's horrible and heartbreaking, because a lot of these people are on a budget. And let me tell you, the scale for them to meet for the help is like, I mean, they could be over $10 and they won't qualify. And that's it. They won't qualify. And so it does mean like, okay, am I going to go my whole rest of my life now without drug coverage? Like, so really, I really emphasize us. Like, I get it. It might sound boring, but it's going to apply to you like someday, or applies to somebody that you love. So I would say share the information with everybody. Talk to people about it. Get the conversation going. I listen to the most randomest crap on podcasts, but let me tell you something. There's going to be one day where I'm going to run into a forensic anthropologist, and I'm going to be able to have a conversation with them. Like, seriously,
but
people.
Did Judy really kill John?
Like, seriously.
And
people.
one more thing, now that you said that, I'm glad you brought that up, because I know you run into a lot of this and you help a lot of them, is the young people that are taking care of their grandparents and kids, or their grandparents and parents. Because guys, it's not just because come on, we're all busy. And I know some of you out there that are listening that are young, that have parents that are hitting the Medicare age, right? Or even in their 50s that are not well, right? That you might be caretaking for somebody, or maybe you're just that go-to person that your mom or dad or grandpa or aunt or uncle calls you, say, Mija, or son, or whatever you.
The girl that we ran into yesterday, that we had the meeting for, she was 21 years old when her grandfather came to live with her, and she was 21 years old, and she said, I wish I would have known. And thankfully she came into the right people who helped her apply for these programs, because everybody isn't as fortunate.
And that's one of the medical groups I was talking about that helps with the Part D if they don't qualify.
Yes, I think it's so important.
But let's talk about this real quick. That yes, y'all need to be a resource, but keep in mind, it's not just stressful for your parents, guys, because guess what? When they can't make the payment, who are they going to go to? You. If they need to get it to the doctor and they can't get their medications, they're going to go to you. It's going to inconvenience your day. You're going to have to take time off of work. You're going to have to pull out money from the bank that you probably don't even have, or because of everything's going up. Maybe you do have it. That's wonderful. That's a luxury, right? That you can help people with their medical bills. But most people don't have time to just take care. That's why there's caretakers. That's why there's those providers. That's why there's those non-aiding medical attendants, because you have to actually hire those companies to sometimes take care of these everyday things for your parents or your aunts, your uncles, or whoever might be experiencing this. So if you can help them as early as you can, make sure that they have the things in place to prevent bad situations, then if you can go to the bar and spend $12 on a drink, you can set aside some money for your parents or grandparents.
Or if you watch the Kardashians on replay for like all day long, you can listen to us for like 30 minutes and get educated on things that literally will affect you. Like the Kardashians and what they do doesn't affect you. Yeah. But this Medicare does affect you. It affects everybody. I tell this I've said this so many times on the podcast. I'm like, it affects every single person, rich, poor, it doesn't matter.
Everybody.
It affects everybody. And I think just becoming educated about it and really learning, taking the time to just learn, because they send you the book every year, right? But people don't read that book. They're like, oh, I don't want to read that.
They're like this.
Yes.
Or they use it to, to start a fire.
They like roll it and hit the freaking roaches with it.
I had a lady using it to hold the door open. I'm like, did you get your book this year? She's like, yes, it's over there. Like,
okay, on the floor, along with all the other years that I've gotten sent.
Well, I totally get it because it's a lot to read.
It's a lot to read.
Even us, it's like, oh.
Yeah, but look, you created a space that's fun and exciting. We're not boring. Where you can come and get educated.
Yeah.
So there's no excuse.
Exactly.
Yeah.
To not learn about this. Not only that, but before you started the podcast, you were making videos about Part D, about Part B, about MAPDs, about supplements.
Do you have Part B?
Like, do you need us to start wrapping
with the back of the hemisphere, my wind blowing?
Remember? Tienes parte B.
Y'all were trying to make it very no, I haven't seen them. But if I see them, I'll probably laugh.
Hey, okay, for those of you guys, for those of you guys that are in a business or in a professional thing that requires you to market yourself, brand yourself, or anything like that, if you want to laugh, go back to our YouTube channel, and there's some that I was doing that I was like, and don't, I'm not saying, oh, Victoria was skinnier back then. Just go back and like, let's look at the way I was like, hi, my name's Victoria Cabrera. And so don't be scared to get on camera is what I'm saying. If you have value to bring to a particular individual, whether that's through education, whether that's through experience, whether it's through anything, get on camera, tell people about it. And you don't have to make it look professional like this, right? This is well, and actually when I look at like the TV shows, I'm like, man, one day we're going to have a little studio like that. And then we're gonna look back to this show and be like, man, remember those days where we were doing it in our little office? That's what I want. So every time you're progressing, you're getting better, you're getting better, you're getting better. Don't overthink it. Like the other day, I told Brooke, that's like, hey, we need to put out. This is the content I want to put out. Let's record it. Let's get it out. I don't want to take too much time. We have 1 hour to get 30 pieces of content recorded quick, right? I think we got about 25 pieces. It was more. She's like, it was more. We have been downloading this stuff. So it was like 30 pieces or something, right? And so I'm like, okay, Brooke, just ask me questions. Go, go, go. And she's like, what about this? And so I had to answer it. So I'm not thinking if I have something in my teeth or if make sure you don't have anything in your teeth. If I'm touching my nose, if I'm making weird faces, because I make a lot of weird faces. I don't know why. I'm like, And then the whole time I'm like, Brooke, my necklace was turned around. And she's like, I know, I saw that. I said, why didn't you say anything? I was like, So yeah, I'm not going to go record content all over again. Good morning. I'd like to know more about Part C. How do I determine if I need it? Anna, I think you already have a Part C. Mm-hmm. Yeah, you're already on a Part C, Anna. Call.
Yeah, so a lot of my clients will call me and they'll be like, hey, I need a Part C. I'm like, well, Part C is a MAPD, it's a Medicare Advantage plan, or people refer to them as all-in-one plans. So I don't know if they do it to just confuse the crap out of seniors or, they'll advertise on TV, oh, get your Part C or get your all-in-one plans. It's still your Medicare Advantage plan. Yeah, they're all the same.
Yeah. Get the Part D and they'll call, or I'll talk to them and they have a Medicare Advantage. I need a Part D. It's like, it's already in there.
Yeah, you already have it.
You're already getting help with your prescriptions.
Yeah. Yes. So there's only... Typically, so it's Part A, Part B, Part C, Part D. Okay. Part C has the three.
They bundled everything up.
It's an all-in-one. So Part C has the D, the A, the B, or the A, the B. So that's Part C. So it's just it's the Medicare Advantage plan. Part C, it's a Medicare Advantage plan, also known as Part C. Wait, no, I said
also known as Part A.
It's not going to show. So because Part C is called Medicare Advantage, you're not going to see Part C on your card. It's just going to show Medicare Advantage. Yeah, it's going to show the plan name. It's either going to say HMO or PPO. That's how you know you have a Medicare Advantage plan.
Yes.
And obviously, if you guys ever have any questions, give us a call. Y'all have your direct number, the direct numbers to the agents. You can always reach us directly on social media or the show, right? That's what the show is here for. So we're always glad that you guys are participating, asking questions, joining us. We love it. We love the participation. We love chatting with you guys. I know, man, today went kind of fast.
What time is it?
It's 10:56.
Oh, really?
Wow. We didn't even get to have fun.
I know.
We were just talking.
We
did. We were talking about saving.
We're talking about saving money. We're talking about insurance. We talked a lot of it. We actually talked a lot about insurance today.
And it was interesting. I mean, it wasn't boring. Sometimes we talk about insurance. It's kind of boring. So that's why we only talk about it a little bit. But today we made it interesting.
Yeah, well, it is because it's so crazy. Yeah. I don't believe that these people, I think that obviously like Victoria's goal is to get to a larger audience because there are people out there who don't know anything, who go without the drug coverage almost their whole career of being on Medicare. And then, when they find out, it's like, well, now you're going to have to pay a penalty.
Yeah.
So I think the goal of us being on a larger scale and really reaching more people will really help.
Yeah.
When
I talk to my clients, I always tell them I'm going to educate them first of all, because they talk to so many other seniors. And so they can explain to them. That lady that came to me yesterday to talk to me, she was talking to somebody at the senior center and they told her, she was telling them, I just got this new plan, blah, blah, blah. She's like, well, go talk to Sylvia to make sure that what you got is good. And so that's why they go, because I try to educate them so that they can educate other seniors, because a lot of them don't know. And so
Anna says, thanks, still on new to me. Yeah, it's a lot to take in, because you know what? That's why we always encourage our clients to join the show and or our customers to always stay in touch, because man, guys, here's the thing. When you enroll into a plan, the advertisements never, ever, 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 ever gonna stop. I'm sorry to say, it's never gonna stop. You're never gonna stop seeing celebrities on the TV. You're never going to stop getting postal mail. You're never going to stop getting flyers that look like they're from the government. You're never going to stop getting phone calls from people. You're never going to stop getting, it's going to keep going and going and going. The only way to combat that is to stay in contact with your agent.
Don't watch TV. Don't.
What we were talking to Mogoli from United. Oh, I can't say one of the carriers that are local with us. And she's been phenomenal support with us. And I loved what she said yesterday. And she said it before. And it's just something that's so simple, but she says, you use your banker when you go to the bank. You have a banker when you go to the bank. You have a person that does the same person that does your taxes every year. You should do the same for an insurance plan.
And I use her exact words yesterday at our meeting.
She's like, you have a trusted bank.
I remember that
you put your money with. You have a trusted CPA, somebody who does your taxes. The same thing with an agent. And that we said that too before. You don't have to work with us, but make sure that the person that you work with, that you trust them. So don't go call. If you're working with Anna, don't go call John and Sammy Joe, because really trust your agent. Don't be calling, and then don't be calling the 1-800 numbers, because they'll switch your plan.
Oh yeah. And you won't even know it sometimes. You'll be like,
it happens all the time.
Yeah.
But I used that yesterday at our meeting. Yes. And so
how did it go?
It went very well.
The AC finally turned on.
And that's one of the things they said when you were saying about all the mail. Somebody raised their hand. If I signed up, will I stop getting mails and calls? I'm like, I wanted to laugh. Actually, I did laugh. I'm like, no, it's going to happen. And you're going to get double calls and double mail because you're just turning 65. And then annual enrollment is around the corner. So you're going to be getting double stuff.
Anna says, that is the truth. I'm happy to have y'all as agents. Yeah, we love we appreciate that. We really, really do appreciate that, because we try, and I posted something on our social media. It's like, look, we're a small business at the end of the day, right? We're not going to make big mistakes, but we might miss your call here and there sometimes, right? But just be patient. Now, if we don't call you back after 5 times of calling, then that's something to talk about, right? But just be patient with us. Text us. The cool thing is, when you work with an agent, at the very least, you should be able to text, call, email, leave a voicemail. If you're calling an 800 number, one thing that you should ask is say, hey, do I have the ability to text you? And if they say, well, no, but you can call this 800 number, that's a good indicator that you don't have an assigned agent to you. Right. So when they don't have those capabilities of texting and you having their direct line and you having their email, then that's a good call. That's a good indicator. That's a call center that you're not going to get the same person every single time. Right. So it's always good to have that local agent that who's calling you. You can save their cell phone. You can save their direct number in your phone. You can text them. You can call them. You're whatever, right? You could see them on the show. You can see them on our website pages. You could see their face, and maybe you never met them in person, but at least you know who you're working with, right? A lot of my clients that I've never even met in person. But we've seen each other like via like a Zoom or via like they see me and I see them on their Facebook, like we're Facebook friends or whatever. So anyway, guys, we have already reached our time. Do you guys have anything that you want to add before we end the show? Thank you so much, Anna. We appreciate the nice words. Sherry for joining in. I can't see who that was on YouTube. Josie, Rebecca, Joe, everybody that was listening in today. We appreciate the support of the show. We definitely want to continue to expand, bringing more people on. And I know I keep saying that, but I think it's because we want to get a bigger space for this room, and because then somebody will have to squeeze right there. But no excuse.
Lose weight?
Yeah, I could. Yeah.
No,
yeah.
we need a big room.
Yeah. So guys, if you don't have any questions for us, or if you do and you still have questions, call us 866-717-8683. That is our line. You'll reach one of these beautiful ladies right here. And if you need us, text us. What's your number, Sylvia?
210-878-9534. 7 days a week.
7 days. Dang. 7 days
calls
a week.
all the time.
That's true. She's not kidding.
I'm not kidding. People call me all the time.
Yeah. She'll be in Cancun. Hello?
Uh-huh.
Okay. I'm in Cancun. Yeah. Mr. So-and-so. I'm like, no, ma'am. No, ma'am. Hey, Sherry, thanks for joining us. I appreciate you joining us, of course, as always. Anything else that you guys want to add?
You know, you made a good point about if your parents, look at your parents' plan. Just figure out what's going on with your parents, how much they're paying, if they're paying too much, their prescriptions. Get involved. You know, we get involved in so many activities with our children, and we kind of forget our parents, you know? And so we need to look at our parents and get involved with what's going on with their insurance and everything else, prescriptions and all.
Yep. Yes.
And life insurance.
Yeah. All of it. Anything insurance wise. Now, we don't deal with home and auto.
Right.
But anything related under the umbrella of health products, life products, we do that. Okay. We talk a lot about Medicare because that's our specialty, but we do have education on other things. And so if you guys have, just use this as a resource. I mean, we get people asking us, hey, where can I go to get this or that? And we try to like use our network to get you in contact with anybody that we think in the community. And although we may not always have the answer to every single question you might have, when it comes to Medicare, we will. But when it comes to just random questions, I mean, obviously we utilize our network. Anything else you want to add, Adriana?
No.
Well, we appreciate you guys tuning in every Friday, 10 a.m. Central Standard Time. I will not be here next Friday, so I haven't even talked to the girls to see if they're going to have the show. I might help make them run the show without me to see that they can go ahead and get this.
Oh, that's going to be fun.
Get this technology situated. I think Brooke might be able to help.
Yeah.
Okay.
So let's see how they do. If you guys want to see Sylvia and Adriana run the show next week, make sure you like the comment, love the show. We will see you. We will see you on the other side. Bye.
What's